You are watching the DocTalk show.
Among the important causes of kidney disease is high blood pressure and diabetes. However, we want to find out if there could be other factors that would cause kidney disease apart from high blood pressure and diabetes. Ms. Olive, the kidney itself, what else can cause this kidney disease, this monster of kidney disease?
Thank you, Darius. One other cause we wouldn't forget about are infections, especially the upper respiratory tract infections and the urinary tract infections, which we shouldn't take for granted.
The usual UTI that people commonly see.
Yes, because when they tend to advance at the end of the day, the moment blood is infected, this blood has got to go through the kidneys. And the moment it goes through the kidneys with very bad infections, definitely they are going to damage the kidneys. The other cause could be drugs, toxic drugs. Most of us like using diclofenac, for example. And the painkillers that we tend to self-medicate ourselves without the help of our doctors or healthcare givers. And they tend to damage our kidneys because we tend to take overdose. If the headache has not gone in 4 hours, you're going to take another dose of diclofenac, which is really not good. And not forgetting also herbs. We have gone into a habit of mixing drugs, the medical drugs, I could say diclofenac, with the local herbs from our local doctors. You either stick to one, but even when you stick to one, for example, if you decide to stick to herbs, you've got to be guided because at the end of the day, it has got to be a dose. It's not a matter of just galloping the herb.
The painkillers we usually take for several complaints, how dangerous are they?
These drugs reduce the amount of blood that is coming to the kidneys. So that is where the problem is. Like we know, most of the drugs have side effects, and this is a side effect of these particular kinds of drugs. So once this blood volume that is coming to the kidneys is reduced, then the kidney cells, the kidneys themselves will be injured. And so it is that injury that will eventually cause a problem.
So
and
the
also,
painkillers can reduce the blood supply to the kidney.
True.
Okay, and cause damage.
Exactly. And in addition, these days we also know we have most of our patients who are HIV positive and also taking ARVs. So the HIV infection itself can affect kidneys, but also some of the drugs that treat the HIV can affect kidneys. So these are also to be looked out for, and these usually can be done by the doctors and the health workers who are actually taking care of these patients, so that they keep checking the kidney function of these patients because they already have the disease, so they are at risk of getting kidney injury. They are already taking their drugs, they are at risk of getting kidney injury, so that when it happens, it can be seen early, the drugs can be switched, and they can get care so that this injury that they've gotten because of the drugs or because of the infection does not worsen into chronic kidney disease.
Okay. So, Dr. Ogavu,
Yes.
a disease like malaria, which is so common in our setting, how dangerous is malaria? No, malaria is a very common illness, but people underestimate its effect. Can it have an effect on kidney?
Yes, we have known malaria to actually, on its own, cause kidney injury. And it's one of the complications and can be life-threatening. Okay. And actually, a good number of the patients that we manage on dialysis for a short time have suffered from malaria. So it's very common. Now, the other thing is, when people have malaria, part of the treatment that is given, or part of the disease itself, for example, you're vomiting and you're having diarrhea, if it comes in, you're not taking in enough, so the blood supply to the kidney gets compromised. Now, the other things that are used for managing malaria, say to manage the temperature, you may get ibuprofen, you may get diclofenac in there. So they are trying to manage the malaria, but as inadvertently, they actually harm.
We're adding more injury.
Yes, you're adding more injury to the kidney. And this actually goes beyond malaria. Any condition that gets you admitted puts you at risk of getting acute kidney injury.
Whether it's any infection.
Any infection, whether it's in the brain or in the lungs, because those other infections actually affect blood supply, they affect your blood pressure, the toxins build up, and the kidneys are already working harder. So now they get challenged by other things. You're dehydrated, and then you get this other drug that is well intended to manage the other infection, but then you get side effects that are actually happening to the kidney.
Okay, there seem to be so many causes of kidney disease.
Yes, so every time you go to hospital, someone needs to mind about your health, your kidney health. Mind yourself, and your doctor
Be
needs to
careful
know.
about the drugs you
Exactly.
take, and the conditions you may be having. Some can cause kidney disease in addition to other,
Yes.
other scenarios. So, Dr. Grace.
Maybe, Darius, one more cause that we should not forget is sickle cell disease. Sickle cell disease is very common in Uganda. A study that was done shows that 15,000 children every year are born with sickle cell anemia. Yes, 15,000. Some of these, most of them will die off before 5 years, but then there are those who grow up into old age. So, like we know in sickle cell disease, usually the cells which are sickled, they clog the blood vessels. And this also happens in the kidneys. And of course, at that time, the kidneys will not be getting enough blood. So it goes back to the blood supply.
Okay. So, Ms. Olive, how exactly would one know they have kidney disease? Is it like a malaria which starts as a fever?
Okay.
How would it present?
First and foremost, from a home setting, one should look out for the urine output. Ideally, in a day, a normal human being should take 3 liters of fluid per day.
We drink a minimum 3 liters.
3 liters. Okay. And then, if urine output is less than 400 mils, then one should worry.
400 is about the size of a tampeko.
Yes, half a liter.
Less than
almost
a
half
tampeko.
Yes.
Okay, Dr. Grace, are there any other signs in
Maybe
which someone can tell?
before the symptoms, to emphasize, by the time we get to see these symptoms, you have actually already lost much of your kidney function. So as you lose your kidney function, the remaining part of your kidney tries to cope and help you and work. That's why you see people who have kidney disease, they can get one kidney and they will still survive and be normal. So as you lose your function, you don't lose your function today and tomorrow. You don't lose 10% and tomorrow you're not passing urine or you're swelling. So by the time you show up these signs and symptoms, you have lost about 90% of your kidney function.
What do you mean kidney function?
So like we talked about at the beginning, the kidney normally filters blood, and there is a normal amount of blood that it filters per minute. So once this reduces, for example, the normal should be 120 mils per minute. So once you reduce it, you can go down at 90 mils per minute, 80, 60. So by the time we see these symptoms, you're below 60 mils per minute. So you're already less than halfway into losing of all your kidney function.
Okay, so we'll come back more to explain more about the signs and symptoms of kidney disease, and most importantly, how you can prevent yourself from getting these kidney diseases. Remember, as you heard from the experts, conditions such as infections or severe dehydration or taking those painkillers, the diclofenac or brufens, can result in kidney injury, and it's a very, very expensive disease to treat, really, really expensive. So we'll come back to learn more about how you can prevent and protect your kidneys. Send in your questions and comments on the social media platforms, check on our YouTube page, and we'll be right back after the break.
You are watching the DocTalk Show.